Hi, we did our project on Katsu training. I'm Dani.
I'm Jerrel.
I'm Megan.
Oscar.
I'm Carina.
I'm Matt.
And I'm Jade. So the origin of Katsu training was developed by Dr. Sato, and the idea kind of started during a Japanese ceremonial. He was sitting in his regular posture, and he just found that the blood circulation in his calves, there was no blood circulation in his calves, so it just started having pain, so that's kind of how his idea developed. And then from there, he started experimenting on himself, using different types of ropes and bands. During one of his ski trips, he ended up spraining ligaments in his knee and then fractured his ankle. And so when that happened, doctors told him he would recover in 6 months, but he ended up recovering in 6 weeks using Katsu training, and so he did it 3 times a week for 30 seconds using isometric holds with the Katsu bands. And then he started developing the product, and then he ended up getting patents in Japan, Europe, and the USA. And then he also started collaborating with researchers at the University of Tokyo and Harvard. And then he also developed a training for Katsu instructors so that they can efficiently teach other athletes or people who use it. And then he also developed a global ink Katsu, which is actually located in Huntington. So Katsu training, ka means additional, and atsu means pressure in Japanese. And basically what it is that they're moderating blood flow in the arms or the legs using these bands that they set the pressure on these bands so it's safe. And we'll talk about more on what it actually does to the body.
So who promotes Katsu, and is there any type of motivation to it? The big one is Katsu Global Incorporated. The reason that they promote it is because they have a cost incentive. For personal use, it costs $2,860, and then commercial use would be $4,805, as well as a practicing license that you need for it. The other person is Dr. Jim Stray Gunderson. He's a surgeon and advisor to the U.S. national ski team. He did a study, and he saw a 10 to 20% increase in strength of cross-country skiers due to the Katsu training. How they did it, it was 10 sessions over a 5-week period, where they were trying to do max reps for 1 minute. This included push-ups, sit-ups, pull-ups, box jumps, and dips, and he does not have any known financial incentive. What is the scientific rationale behind Katsu training? Basically, the pressure in the bands restricts the blood flow, and it increases the blood in the limbs. What this does is it causes unused capillaries and unused muscle fibers to fire and then fill. This means that you can have more lactic acid for lower intensity workouts. When the pituitary gland notices this increase in lactic acid, it'll release more growth hormone, which will cause more muscular and vascular growth. The hypoxic conditions will increase the whole body lactate, which will in turn result in performance benefits. And then the low intensity training means there is less muscle repair and they can add up faster to it.
Okay, the reason for Katsu training becomes popular right now is because of its really fast results, even though in a very low intensities. From the studies that we can see, during 2 weeks with the Katsu training, we can increase the strength and also the muscle size and also the circulating IGF-1. With 3 weeks of training, even with the 20% lower intensities, we can also see the result of hypertrophy and also the increased level of growth hormones.
All right, and to cover some of the cons. So the cons showed that studies would show a short term of hypertrophy, so the body would look bigger, but some studies showed that it was only within 48 hours because these cells would pretty much just inflate themselves. So you look bigger, but no real benefits. Also, other studies showed that the full body had no correlation towards actual strength or conditioning. So most of these were just false hopes of gaining more strength and conditioning.
Alright, so just to reiterate some of the pros and cons for Katsu training, one of the pros is that there may be hypertrophy and an increase in muscle strength with fewer low-intensity workouts rather than the high workouts. And then one of the cons is that the hypertrophy may be observed in only a short-term effect rather than gaining actual muscle.
So based on these pros and cons that we had to do a future study to further investigate this type of training, our experimental design, we wanted to see if traditional strength training program with the mixture of Katsu training would lead to higher hypertrophy in the muscles and then better strength. So one thing we tried to look at was the triceps brachii and the pectoralis major during a bench press. We wanted to see if Katsu training and traditional strength training combined would lead to higher growth of muscle and lead to higher strength. So we would look at the cross-sectional area and then the for strength. We would look at the 1 rep max for the bench press and see before the training regimen and then after the training regimen and see if our 1 rep max increased. For the control, it would be a traditional training program, and then experimental, we would have different groups of Katsu and traditional programs combined, and each group would have different workout intensities and frequencies to see which intensities and frequencies would be the most effective for this training program. With these results, we would find out if Katsu training is worth investing in and adding into our workout regimen. So what we want to take home for you guys is to, for Katsu training, was that we found that post-op patients increased in recovery time, so it was a short amount of time to recover from an injury. And for the elderly, the light resistance and intensity allowed it easier for them to participate in this type of workout, so they gain more strength from it. And one thing that they were also looking at was astronauts. Since when you go into space, you usually lose some type of muscle mass from being weightlessness and gravity. So they wanted to see if the Katsu training would lead to decrease the atrophy symptoms. And as a whole, we wanted to say that for the fitness community, that Katsu training was only suitable for certain types of lifters, like bodybuilders, because Olympic training and sports-specific athletes wouldn't benefit from this. And so we would advise others to just continue with traditional strength training programs and for now, stay away from Katsu.
And lastly, these are our recommendations.